is a CJASON podcast, and I'm Magdalene Assimon, a research assistant professor at the University of North Carolina. I will be joined by my co-author, Jenny Flythe, to talk about our recent study titled Zolpidem versus Trazodone Initiation and the Risk of Fall-Related Fractures Among Individuals Receiving Maintenance Hemodialysis.
Hello, I'm Jenny Flythe. I'm a nephrologist and associate professor at the University of North Carolina. Insomnia is common among people receiving maintenance dialysis and is associated with lower quality of life and many other adverse outcomes. Not surprisingly, patients on dialysis have identified insomnia relief as a top research priority. Even though guideline bodies recommend cognitive behavioral therapy as the first-line treatment option for insomnia, this therapy remains inaccessible to many patients. As a result, we often rely on medications to help our patients get a good night's rest.
Zolpidem and Trazodone are the drugs most frequently used to treat insomnia in the United States. Both of these medications have side effects including dizziness, drowsiness, and motor impairment that can heighten the risk of falls and resultant fractures. In fact, patients receiving hemodialysis may be particularly susceptible to the disorienting effects of insomnia medications due to their frequent use of other drugs with sedative effects and recurrent exposure to dialysis-induced blood pressure shifts, among other factors.
Despite widespread Zolpidem and Trazodone use, little is known about the comparative safety of these medications in patients receiving maintenance hemodialysis. Therefore, we undertook this study to determine if Zolpidem or Trazodone carries a higher risk of fall-related fractures in the hemodialysis population.
We conducted a retrospective cohort study using data from the United States Renal Data System and a user study design. Our study population was comprised of adult patients on maintenance hemodialysis who newly initiated Zolpidem or Trazodone therapy between 2013 and 2016. Our primary outcome of interest was the occurrence of a hospitalized fall-related fracture event in the 30 days after starting one of these medications.
Over 31,000 patients receiving hemodialysis were included in our study. 61% of patients were new initiators of Zolpidem, and 39% were new initiators of Trazodone. We found that patients who initiated Zolpidem, especially at higher doses, had a higher 30-day risk of fall-related fractures compared to patients who initiated Trazodone.
Additionally, our subgroup analyses suggested that the observed association may be more potent in patients with risk factors for falls and fractures, such as older age, a higher degree of frailty, and use of other medications with central nervous system activity.
In conclusion, Zolpidem was associated with a higher risk of fall-related fractures compared to Trazodone in individuals receiving maintenance hemodialysis. The findings from our study suggest that clinicians need to exercise discretion when prescribing Zolpidem. Trazodone may be a safer option, especially in patients with risk factors for falls and fractures. If Zolpidem is unavoidable, lower doses should be used, and patients need to be closely monitored for signs of impairment. Thank you for your interest in our study.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.